Illinois Governor J.B. Pritzker says Republicans and the Trump administration are wanting to knock people off of health care. But a budget he signed this week does just that by ending the health benefits for immigrant adults program in the state of Illinois. Welcome in. It's Illinois in Focus Daily. I'm Greg Bishop, and you can subscribe, join us each and every weekday morning. Pretty lively bunch in the chat room, so if you catch this show afterwards, think about catching it live as we go live to tape here. All right, so let's get into this. The $55.2 billion spending plan is the most expensive state spending plan in Illinois history. Governor Pritzker signing that. It includes tax increases on tobacco taxes, going up 45%, not just for tobacco, but also for vaping products and for, say, those little nicotine salt pouches that people get as a kind of smoke suppressant type thing. That's going up to 45%. You're going to have increased cell phone surcharges. You're going to have increased taxes on some bed and breakfasts. You're going to have increased taxes on sports wagering. You're going to have a slew of different corporate tax changes that if you fit into that category, you might have to talk to your tax attorney about how that impacts you, and a whole host of other kinds of new revenue generation and sweeping type things going on in that budget. Again, the largest state budget in state history. But one thing that it doesn't do, it does not continue the health benefits for immigrant adults program. So there's two programs that the state of Illinois implemented over the past 5 to 6 years. And I remember it was the first kind of major policy initiative from like Delia Ramirez when she was a state representative at the State House before she went on to Congress. She wanted to get, during the COVID years, the health benefits for immigrant seniors program in place, and that passed. And then they expanded it a year later to the adults. So it was covering people 42 to 64 and then 65 and up. All right, so those were the two programs. Republicans said that the estimated costs, which were a couple of $1 million, was going to balloon exorbitantly. And they ultimately demanded for audits of these two programs. And an audit came out showing internal reporting errors by auditors who tested some of the cases, showing people who shouldn't have been enrolled in there and a variety of other internal reporting issues. But it also showed that the state of Illinois taxpayers were ultimately paying $1.6 billion for non-citizen health care over 3 years out of these two programs, with large cost overruns and, again, internal reporting errors to the tune of hundreds of millions of dollars more than what was expected to be paid for. So here we are now in the final weeks of the current state budget. July 1st is the beginning of the fiscal year 2026 budget. So the fiscal year for Illinois is July 1st to June 30th the following year. That's the fiscal year 2026 budget. This budget does not include funding for the health benefits for immigrant adults. So that category of non-citizens from 42 to 64. And it cuts that out. And that's after the state had spent around $330 million in the current fiscal year on that immigrant adult health subsidy. Governor J.B. Pritzker asked about why it's not in the budget, and he said Monday, after signing the budget, that it was an expensive program. But he was asked about, listen, people are saying you're the only person who's removing people from healthcare roles, regardless of the citizenship status. Pritzker has criticized Republicans, saying that the big, beautiful bill that the House passed and the Senate's working on in Congress, Pritzker and other Democrats say Republicans are wanting to take people off of health care roles. But that's what Pritzker just did by signing the budget into effect earlier this week on Monday.
Yeah. I just happened to have been in Minnesota. They also had a program that they eliminated, so we're not the only state. Lots of states have faced the challenge of budgeting and balancing their budgets this year. This was part of the challenge that we had to address. It was a program that had been growing significantly in cost. I do believe that everybody should have health care. I also know that we have to live within our means in the state of Illinois, and particularly because of all the mismanagement that's occurred over so many years. So we've got to rein it in and make sure that we're actually balancing the budget. And that was part of the decision that was made with regard to that program. As you know, we kept the program that's focused on seniors who are the most vulnerable. And it's true that when people don't have health insurance, that they often end up in an emergency room, and that can cost taxpayers more than the coverage that we might otherwise provide. We've got to work out how we're going to cover everybody in the state of Illinois, and that's something that I believe significantly is the job of state government and something that we'll continue to look at.
But again, at what cost? Because again, it was projected it was going to cost several $1,000,000 initially when this first was brought out several years ago. That it was 130, and then it was 400 million, and then it turned out to be major cost overruns, internal reporting errors, and a lack of accountability to where Republicans were demanding there to be more audits of all of this stuff. And we get that audit that shows the cost overruns and the internal reporting errors of both programs, not just the health benefit for immigrant adults program, but also the health benefit for immigrant seniors program. So we're getting rid of HBIA, the adults program. July 1st, program's going to be done. No longer is the state going to spend $330 million on that as they did in the current fiscal year. But the seniors program, the HBIS program, that continues in the new budget with a budgeted amount of $130 million. So that's going to continue on. During the House floor debate on the budget bill, State Representative Bill Howder, he is a medical doctor, an emergency room physician, and a Republican from Morton. He said there's some serious consequences if the state continues on with funding non-citizens who are ineligible for public tax dollars to pay for their health care. Here he is debating back and forth with the bill's sponsor, State Representative Robin Gable, a Democrat from Evansville.
So there's nothing in this budget that funds illegal immigrant health care of those under 65.
Not in our budget, no.
Does the Democrat majority plan on continuing HBIS?
It's in the budget this year, yes.
So you're committed to doing the HBIS program this year, even if there is coming penalties from the federal government, including the FMAP penalties that will trigger Illinois' trigger law that may risk the whole ACA Medicaid expansion program?
From my understanding, anything that decisions that are made at the federal level do not become effective until after this budget year.
The people of Illinois deserve to hear if we are willing to risk the entire ACA expansion program in defense of the HBIS program.
There is no risk to HBIS or our Medicaid program this fiscal year.
To the bill.
To the bill.
This budget is an acknowledgement that we were right about HBIA, and we will be about HBIS. The tax and spend Democrats, called tax and spend by their speaker, are so unfamiliar with cost cutting, they call it chaos. They wasted billions, and they are prepared to waste billions more. Wake up, Illinois.
So Howder obviously pointing out that if the state continues to fund non-citizens who are ineligible for public tax dollars to fund health benefits, then the state could very easily lose out on federal funding. And that's something that, for instance, Illinois could see billions of dollars of loss of federal funding. Yeah, it might not come for another year, but if the state continues on, then the consequence could be significant. All right, it's Illinois in Focus Daily. I'm Greg Bishop. Like, subscribe, hit that notification bell, and join us each and every weekday morning as we bring you the latest here in the land of Lincoln.